I'd like now to talk about the decision as to how do you choose between all the different treatments for prostate cancer. Prostate cancer is not one thing, it's many things. So let me take you with a walk through the principles of how we help patients make a decision between which treatment is the right treatment for them. Firstly, it's important to know whether you have a prostate cancer which needs to be treated or doesn't need to be treated. If you have what's called an insignificant cancer or a level 1 cancer, previously known as a Gleason 6 cancer, the evidence is now overwhelming that the first management option should be monitoring it, or what we call active surveillance. Making this field even more complicated is all the new treatments and new imaging that's coming in. Not only is active surveillance extending to even intermediate cancers, but there's now new radiotherapy techniques with MR-Linac machines. There's new focal therapy options with the nanoknife. There's better surgeries with the robotic surgery. And there's better imaging to be able to know exactly the extent of the cancer with PET scanning and MRI. All these things have made it more difficult and more challenging to tailor the right treatment for the right patient at the right time. The principles of tailoring the treatment, naturally, is to explain every treatment option, its cure rate and its side effects, possibly presenting your case at a multidisciplinary meeting, possibly getting second opinions, explaining the success of every one of the treatments and which treatments are available at your individual institution. In addition, a multidisciplinary team of nurses, pelvic floor physiotherapists, clinical psychologists, and sexual health physicians may be necessary to help you make that final decision. Everybody has their own priorities. These may vary from a fear of incontinence to a very high priority on sexual function to a fear of surgery or a belief in medications. All these things influence the individual decision, and my job is to make sure that the individual patient has minimal regret. One of the key elements in decision making is to make patients realize that there is no rush. It's much better to spend a little bit more time researching all the options than rushing in and regretting your decision for the rest of your life. So what are the factors that might affect this decision? Well, clearly there are tumour factors. Is it a grade 1, grade 2, grade 3, grade 4? Is it extensive? Is it outside of the prostate? Is it into the lymph glands? So the extent of cancer is paramount. The second thing that's important is the size of the prostate and the urinary symptoms that go with it. For example, a very big prostate with urinary problems is often better treated with surgery rather than radiotherapy. The most important factor, of course, is you, the patient. The patient has priorities. They put important emphases on different things such as sexual function, urinary function. They may have particular biases which have been introduced from their own personal experiences. These all need to be considered when trying to tailor the right treatment to that patient. So the individual health factors in the patient may also affect it, such as whether they have certain conditions which may make radiotherapy dangerous, such as ulcerative colitis or Crohn's disease, whether they've got a fractured pelvis which may make surgery difficult, whether they've had previous surgery or radiotherapy which may make radiotherapy dangerous. All these things need to be taken into consideration when making the decision. One of the other factors which I've learnt over the years plays a big role in decision making is the nature of the patient. Are they a pragmatic type of person who believes in surgery? Are they a person who under no circumstance will consider surgery? Whether they're a type of person who believes in medication, whether they're a I trust my doctor type, or they're a type that wants to research every last detail until they make a decision. All these things need to be taken into consideration when making treatment or management decisions. Again, there's no rush. So where do I sit with all this? I'm very privileged to be able to be experienced in almost all the different treatments. Active surveillance, robotic surgery, transperineal biopsies, all the latest imaging techniques, brachytherapy, MR-Linac radiotherapy, and most recently nanoknife focal therapy. So having experience in all of them, I know who it suits and who it doesn't suit. So I can add my experience to help the patient make a decision as to which is the right treatment for them. The final decision, of course, is the hard one. But everybody needs to make a decision in the end. That decision may be to walk away and not treat it at all. But if you do treat it, then the aim is to avoid regret. And any mechanism of avoiding regret is important. Often it boils down to trust of their physician or their team who are looking after them. There may be the same treatment offered by two teams, but you trust one team more than the other. That's an important factor when it comes to human treatments. It also comes down to experience and outcomes, and whether these experience and outcomes are based on evidence or hearsay. If it's based on evidence, I think the patient will feel more comfortable and more confident that they're going to achieve those outcomes. More importantly, they won't suffer with any regret after they've made the decision. So, after 30 years of trying to tailor treatments to patients in a much more complex environment now with many management options and many people involved in the care, the problem still continues, which is how do we match the right treatment for the right patient at the right time? That is a long discussion. Almost have to put yourself in your shoes to try and work out what the right treatment is. So how do you choose? It's not an easy process. It may take 3 or 4 consultations, but it's better to get to that point slowly and with the right person than make a mistake which may cause lifelong regret.